Hello and welcome to The Virus. I'm Dr. Norman Swan. Throughout the pandemic, parents have consistently been told that COVID is a mild virus for children. That's now led to concerns about complacency, with the vaccination rate among Australian children stalling in the past few weeks. The head of Australia's medicines regulator, the TGA, had this message for those who've questioned the importance of COVID vaccination for children.
I just want to remind people of the importance of vaccination of children, because there's been a lot of talk saying, well, kids don't get very sick with COVID, why are we exposing them unnecessarily? And while the numbers are still being reviewed because of things like coroners and post-mortems, we believe in Australia there have been at least 6 deaths of children with COVID, a number more hospitalisations, and now somewhere between 150,000 and 200 children under 10 have caught COVID in Australia. So that's a very significant impact, and also the impact on transmission to parents and grandparents and so forth. There's also a serious condition that between 40 and 50 children in Australia have called multi-system inflammatory syndrome. And it's not long COVID, it's additional to long COVID and separate to long COVID. And these kids can be sick for months. So I get a little bit grumpy when people say COVID doesn't affect kids, it's just like having a cold. Luckily for many kids it is fairly minor, but try telling that to the parents of those children who have become sick. So that's really important to emphasise, that kids can get sick.
Coming up, we'll be joined by 2 experts who've been looking at what can be done to boost the number of children getting the jab. But before that, let's bring in Casey Briggs to talk us through the figures.
Hi Norman. Well, let's start with the national picture of virus cases, because this week, after weeks and weeks of improvement in the overall infection numbers since a peak in mid-January, we have seen this week for the first time an increase again in the numbers of cases. Small but definitely real, and part of the reason for that is, of course, that WA is on the climb. Thursday and Friday, both days now, where more than 2,000 infections have been reported by that state. But it isn't just WA. We're seeing increases in Tasmania. We're seeing similar things happening in the ACT as well, a lift over a couple of weeks now. Even in New South Wales, where the increase is a little bit smaller, a little bit harder to see, but it is definitely real and measurable this week, higher than last week. Deaths across the country, well, they have really stalled this week as well. We're now looking at, well, about an average of 35 deaths every day, and it's been 35 or so for the entire week. You know what else has stalled? Vaccination rates, particularly those among our youngest. This is the vaccine coverage for 5 to 11-year-olds. Just over half of that age group have had their first dose. Of course, a very small number have had their second dose so far. Hopefully that number will start to pick up soon as well. And there's a lot of variation between the states and territories on this number, by the way. The ACT and Tasmania are doing very, very well. New South Wales is second last in the country at the moment, with under 48% of 5 to 11-year-olds covered. Queensland, quite a way behind, less than 43% of the 5 to 11-year-old population there have had a first dose. And this has really started to plateau in recent weeks. This shows you first dose coverage of various age groups. I can't fit every age group on this chart, so I've selected a few through the years, and you can see the plateauing that's occurring and how much lower it is among kids. Among some of the older age groups, we're seeing, well, among virtually all adult age groups, we're seeing more than 90% coverage, and it's as high as 99% and higher in most of the older age groups. This is 5 to 11-year-olds, and you can see that surge is well and truly over. This number's very much just creeping up at the moment. Among adolescents, 12 to 15-year-olds, we're looking at about 85% of that age group have had their first dose of a COVID vaccine. Now, this isn't entirely a surprise. We've seen a consistent pattern around the world of lower vaccination rates among younger age groups. And in fact, indeed, Australia's numbers for 5 to 11-year-olds are still higher than many other countries around the world, including some very high vax countries, Denmark and Italy, for example. This has beaten the 5 to 11-year-old age groups there. But Norman, we know Australia is a country that wants to overachieve in these vaccination numbers. We know every vaccine that goes into an arm does make a difference in protecting not just an individual, but the entire population. So the question is, are there any ways that in Australia we could push this number even higher?
This week, government and community leaders came together to discuss the stalled vaccination rate among children. The forum was convened by Professor Julie Leask, who studies vaccine hesitancy. Also in attendance was Professor Christine McCartney. Christine is Director of the National Centre for Immunisation Research and Surveillance, as well as being a paediatrician specialising in infectious diseases and vaccinology. Professors Leask and McCartney join us now. Welcome to The Virus, you both. Julie, what happened at the meeting?
Well, we got together researchers who are looking at why parents aren't vaccinating, people who are very familiar with the coverage figures from the federal government, and people from the community, from health professionals and from government to look at why this plateauing is occurring and what we can do about it. So
why is it occurring? What are the sources of hesitancy?
Well, first of all, it's not just hesitancy that's limiting uptake. We think that certainly there are families who don't see COVID as particularly risky for their children, and so they're maybe holding off from vaccinating, waiting to see what the safety data says about children's vaccinations, and also seeing that there might not be such a need for children. And there are also people who are confused by the recommendations because they have changed frequently. And then we've got this practical side of things where families have gone back to work, the kids are back at school, they're busy, they're dealing with multiple priorities, and they may just not put vaccination at the top of that list of priorities, even though they have some good intentions there. And there's finally a group of families, and this will affect particularly children with disabilities, for example, or the younger children, where the children are worried about having a needle, distressed, and the parents don't want to see their kids distressed by needles as well. So there's several things affecting uptake right now.
I mean, Christine, this distress from a needle, I mean, most of these kids will have been fully immunised up to this point. I mean, how real is that needlephobia?
Well, I think it does exist, and good news is that there are many great strategies with how to deal with this. I think it's important to remember that we have had COVID vaccines delivered very quickly in large hubs. It has, it's been a bit of a different experience for parents. And where we've seen success for children is actually where there can be child-tailored services. We know that in all paediatrics. And there were some great examples in the workshop which are being shared across the nation now around really paediatric-specific focus. Kids have gone through a lot of stressful experiences with COVID, and, they, like their parents, might have some heightened concerns around getting a vaccine. They often do. They may not be remembering their shot.
In that grab we saw earlier, Professor Skerritt was clearly frustrated and quoted some major statistics in terms of childhood severity. Have we overshot in telling parents it's a really mild disease?
I think we need to be very clear with parents on where the risks lie. So, on the one hand, if we overshoot on messages about risk, then we create a whole set of anxieties, as we know, that have occurred. But I think parents can deal with risk information, and they can process the fact that their child could be one of the small number of children who have to go to hospital. And also there are many children who have chronic illnesses, for example, that put them at greater risk of severe disease from COVID. So we've done this with chickenpox vaccine programs in the past, where we have a disease that's very infectious, where most kids, it's a banal disease for most kids, but a handful of children get very sick from chickenpox, and people have accepted that vaccine. So I think that also hints at some of the solutions to improving vaccine uptake in kids, so we get that broad-based protection.
So Christine, run through safety and effectiveness, because there was some study this week which suggested, on the past few days, which suggested that there's a more rapid waning in children from the vaccine in 5 to 11-year-olds. But first of all, the safety.
Well, look, we have a huge volume of data now on safety in this age group. These vaccines have been given to over 11 billion people and many, many, many millions of children in this age group, a really, really strong safety profile. There are those short-lived expected side effects for a day or so of sore arm, maybe feeling a little bit of a headache. But we have a program called Vaccination Safety, which tracks safety. And we're finding kids in the 5 to 11-year age group, for example, are a lot more comfortable than some middle-aged adults who might be getting the vaccine. So parents should be reassured there. Similarly, the risk of this very rare heart inflammation turns out to be a lot lower in 5 to 11-year-olds and really exceedingly rare. It's a treatable condition that, again, goes away over time. So, and no long-term side effects that have been discovered for these vaccines, which parents understandably ask about.
And vaccine effectiveness?
Great, Norman. On the effectiveness side, there were results from the clinical trials. They showed strong efficacy. Now, there are 2 studies out of the United States, and they have slightly differing impressions with effectiveness, one showing a more high effectiveness, the other suggesting the effectiveness didn't look as high. But this is early days, and we need to take each of these studies with a grain of salt. The United States also has a very different history with COVID than we do, and the way in which these studies are conducted is still being scrutinised. So what's most important is that we do need to train our immune systems to learn to live with this virus and to be able to fight the virus when we meet it, because it can be severe in a proportion of children. And getting vaccinated is a really important step for children on that journey.
And the likelihood of children needing a 3rd dose, like adults?
Oh, look, I wouldn't think that's on the cards at the moment, Norman, but I think one of the questions that we identified in the forum that has come up is parents might have had a child who has been recently infected and they're thinking, well, should I still get them vaccinated? So, Julie alluded to the information needs of parents, and I think this is where we're going to seek to do even better and stronger. If a parent's listening and their child has been infected, they are still recommended to receive the vaccine, but they can understandably, wait for a couple of months after their child's infection. And we know we have maybe, a couple of 100,000 children in this category. So again, that contributes to why we think some parents might be waiting.
So, Julie, the solutions here to get more kids vaccinated?
Well, we heard on the forum about some of the incredible tailored solutions and community engagement that is happening. And in fact, it was useful for people in the forum to hear from others on what they're doing in their state or territory. But we also need very clear messaging about where the risks from COVID do lie in children, clear messages about the safety of vaccines. And I note that things like decision aids can be helpful for parents who are very ambivalent. And in fact, the National Centre for Immunisation Research has launched a decision aid yesterday for parents considering the COVID vaccine for children, and particularly those who feel a bit hesitant.
So this is where you can go online and actually go through a series of questions and answers for yourself.
You weigh the risks and benefits with helpful graphics and consider what's important for you in terms of protection for your child. We also need to be strengthening those very locally based community engagement efforts and supporting the champions for vaccination who are already in communities with the information they need. And we heard about wonderful efforts in Victoria around that. And we also need to make sure that people can easily access the services. We already can see in the data a major difference in uptake between regional areas and some inner city areas. So we need to address some of those disparities with good equal access. And we also need to make sure that we implement things at scale as well. So we heard on the forum about some of the strategies that improve vaccination coverage from global evidence, like SMS reminders or letters, for example, where you make sure that you use very specific messaging, for example, that says, there's a vaccine reserved for your child. Come to this clinic next week.
Look, thank you very much to you both, to Julie Leask and Christine McCartney. Thank you very much indeed. Very informative. That's the programme for today. I'm Norman Swan. Bye for now.